morning, everyone, or good afternoon. I want to thank you all for joining us here for this important announcement today. I'm thrilled to share that we are announcing the first ever Cook County Health Doula program. This is a groundbreaking initiative aimed at improving maternal health outcomes in our communities. This program is a direct response to the stark and unacceptable disparities in maternal health that have plagued Black women for far too long. And in Illinois, Black women are 3 times as likely to die from pregnancy-related causes than white or Hispanic women. The numbers don't lie. More than 90% of maternal health deaths are preventable. Yet they continue to occur at alarming rates. This is a public health crisis that we can no longer ignore. 2 years ago, I held a maternal health hearing to confront these disparities, especially as the pandemic exposed them and worsened them. We listened and learned, now we're acting. We, with the support of President Preckwinkle and the Cook County Health leadership, Dr. Eric Makaitis, I secured $1 million in this budget to support this doula program, a critical investment in the fight for equitable health care. So why are we focused on doulas? Doulas are not just people, they are trained professionals. And we are so fortunate to have some with us here today. And also important to explain the role that doulas take in how the services that they provide. As a mother of 2, I can definitely understand the need for impactful, caring maternal health care. And it can be an exciting time, but it also can be a very vulnerable time for women. And as we hear this data, we know that doulas can not only provide the support, but they provide the physical aspect of pregnancy, but also emotional aspect. The evidence is very clear that according to the American College of Obstetrics and Gynecologists, continuous one-on-one support from doulas improves outcome for women in labor. Yet only 6% of women in the U.S. have access to this care. But Cook County Health is changing that. This program isn't just a milestone, it's a lifeline. Through culturally tailored, patient-centered care, the Cook County Health Doula program will provide essential support to women who need it most. It's more than just physical care. It's advocacy, it's education, and it's empowerment. Now more than ever, we must ensure that Cook County offers the full spectrum of reproductive health care. And I'm proud to stand here today with our dedicated team to launch this program, which will transform lives and set a standard for others to follow. Together, we are rewriting the narrative of maternal care in Cook County. I want to thank everyone who made this possible, especially under the leadership of President Preckwinkle, who championed this initiative from the very beginning. We also have others who are joining us here today who you will hear from. Commissioner Bridget Degnan, my colleague on the county board, as well as Nicole Harvey, who is here from Congressman Danny Davis's office, and all the other amazing colleagues here from Cook County Health, and our esteemed physicians who are also here from the health hospital system. This is a group effort, and without all of us, none of this would have been possible. So it's now my honor to introduce Cook County Board President Tony Preckwinkle, whose leadership has been very instrumental in making this vision a reality.
Good afternoon, everybody. Excited to be here today as we celebrate the beginning of the Cook County Health Doula program. I want to thank Commissioner Miller for her hard work on this initiative. I'd like to thank Commissioner Degnan for being present, Dr. Eric Makaitis, Dr. Fidel Abrigo, Christina Urbina, Vivian Moreno-Barrett, Shalonda Carter with Cook County Health, and Nicole Harvey, who's here as Chief of Staff of Congressman Danny Davis. Doulas provide crucial support, as you heard, during pregnancy, labor, and postpartum, helping improve maternal and infant health outcomes. Studies show that continuous support from a doula can reduce the likelihood of cesarean section, shorten labor, and improve overall birth satisfaction. You know, my grandmother used to say, if men had to give birth to children, the race would have died out a long time ago. And she wasn't talking just about black folks. Doulas can also play a pivotal role in addressing racial and socioeconomic disparities in maternal health care. Black and brown women in particular face the highest rates of maternal mortality and complications. And 80% of maternal deaths are preventable. Doula support can help bridge these gaps by offering emotional support, education, and advocacy. Doulas empower families by providing information about childbirth options and advocating for patients' needs, helping to ensure that women and families have informed choices during labor and delivery. They can also help families navigate complex medical systems, ensuring that individuals from all backgrounds can access the care that they need. We want to ensure that women have access to compassionate care, not just during their pregnancy, but during the most vulnerable times after delivery. I'm grateful to everyone who's worked on this project as we seek to do our part in Cook County to improve the well-being of parents and children. And now I'd like to bring to the podium the head of our health and hospital system, Dr. Eric Makaitis.
Okay, good afternoon, everyone. Good afternoon. Thank you for joining us today. I'm Dr. Eric Makaitis, CEO of Cook County Health. It's a pleasure to be here today to celebrate the launch of the Doula program at Stroger Hospital. I'd like to start by thanking President Preckwinkle for her advocacy for maternal child health and the well-being of all the residents of Cook County. I'd also like to recognize Commissioner Miller, who championed this program, among other important women's health priorities, as well as Commissioner Degnan. Thanks as well for the support from Congressman Davis, represented today by Nikki Harvey. And lastly, I want to thank our team here, our maternal health team, led by Dr. Fidela Brego, Chair of OBGYN, and Christina Urbina, our Service Line Director. Cook County Health is investing $1 million to bring a doula program to our flagship Stroger Hospital. Doulas provide person-centered, culturally competent care to birthing parents and their babies, serving as an invaluable resource to families during pregnancy, childbirth, and postpartum. Their presence has been shown not just to improve the birth experience, but to improve health outcomes. This is extremely important as we continue to see staggering disparities in maternal outcomes in our region, particularly in African American women. Research has consistently shown that doulas can help reduce these disparities. This is an important step to achieving health equity. With the support of doulas, patients who give birth at Stroger Hospital will be empowered. They'll have another advocate by their side, and they'll have the resources and support needed to thrive through the momentous occasion that is the birth of a child. Cook County Health is proud to provide the full spectrum of reproductive health care to our patients. The ability to decide whether or when to become a parent and then have a safe, supported birth is fundamental to a person's dignity and equality. I'll also note that our own Cook County Department of Public Health recently launched a new website, everymother.everychild.org, that provides a virtual resource library for every stage of pregnancy. It's a great site, and I'd encourage everyone to check it out. Again, that's everymother.everychild.org. With that, I'll turn it over to our team who's been instrumental. Oh, actually, wait, nope. I'm going to actually turn it over to Commissioner Degnan.
Thank you. Good afternoon, everybody. Good afternoon. Push this down a little because I'm so short. My name is Bridget Degnan, and I'm proud to serve the residents of the 12th District of Cook County, which covers parts of Chicago's north and northwest side. I'm also so proud and honored to be here with all of you here today, particularly Commissioner Donna Miller, who really spearheaded the doula program here, Cook County Board President Tony Preckwinkle, who supported it, as well as the whole Cook County Health and Hospital system, including Dr. Eric Makaitis. I'm also proud to call Commissioner Miller my seatmate on the county board. We talk a lot while we're sitting there for hours in between committee meetings, and this, I know, has been of particular importance for her for many years, so I'm so pleased and happy to see it become a reality. She's a dear friend, and I consider her a sister. So today is a great day in Cook County, a county that believes in freedom, autonomy, and equity. Following the leadership of Commissioner Miller and holding public hearings on the maternal mortality crisis in this county and across the nation, she advanced the Cook County Health Doula program, which is now being funded, as you heard today, to a tune of $1 million. Make no mistake, it is a historic day. Our first job as public servants are to protect the residents we serve. That means no one should die a preventable death giving birth to somebody or postpartum. We know that there's a maternal mortality crisis in the United States. Each year, tens of thousands of women experience life-threatening pregnancy and postpartum complications. And between the years 2000 and 2020, the rate of U.S. maternal deaths skyrocketed 78%. We also know the maternal mortality rate for Black mothers doesn't improve with socioeconomic status or educational levels. For example, data from 2007 through 2016 shows that among women with a college degree or higher, the pregnancy-related mortality ratio was 5 times higher for Black mothers compared to white mothers. Experts suggest the reasons include a lack of access to quality and affordable health care, limited postpartum care that typically ends at 6 weeks following delivery, delayed recognition of risk and complications, systemic discrimination, and implicit bias. In Illinois, though, we believe in freedom, bodily autonomy, and equity. So we do things like expanding Medicaid to cover postpartum care. In Cook County, we have advocates like Commissioner Miller and many others here today who have fought for reproductive health services and maternal care for many years. For the women who are able to and do choose to bring a child into this world, many are justifiably scared. They talk to friends and neighbors who have had similar difficult experiences. And this fear is real. Distrust in institutions and care systems is real, and something that we must admit and address head on. And that's why this doula program is so important. There's an added level of trust between doulas and their clients. While it is not for everyone, having this option can and will save lives. This critical program says to the people of Cook County that we respect you and we respect your healthcare decisions. By providing free doula services to patients in need, we are speaking with a clear and united voice. We take this crisis seriously, and we're advancing our moral compass through our budget. I want to again thank Commissioner Millers, my colleagues, and Cook County Health and President Preckwinkle for supporting efforts in this critical program. Let's keep fighting to save lives in Cook County. And next, I'd like to bring up Nikki Harvey, the Chief of Staff for Congressman Danny Davis.
Well, I am simply delighted to be here with you guys on today. My name is Nicole Nikki Harvey. I am the Deputy Director and the Deputy Chief of Staff for Representative Congressman Danny K. Davis. On today, he is elated to stand with his good friend, Tony Preckwinkle, and also Donna Miller, Commissioner Miller, who is, she is just a star in his eye, and also with our other commissioner that's here and to the county board. Statement of Congressman Danny K. Davis. It's Giving Tuesday, and I am delighted to stand in solidarity as we celebrate and support those who are the givers of life, the mothers of our nation. As the ranking member of the House Committee on Ways and Means and Subcommittee on Workers and Family Support, I am peacock proud to celebrate one of my critical pieces of legislation aimed at helping children and families thrive. In year 2024, maternal, infant and early childhood home visiting, McV, program allotted $440 million in states and tribes, with over $11 million being granted to Illinois. This program provides vital support to pregnant women, new mothers, and families with young children through regular planned home visits and by trained professionals. These visits improve healthcare outcomes, parenting skills, child development, and access to essential resources and services, including doulas and midwives. For decades, making this life transformation program accessible to those in need has been one of my top priorities. On this Giving Tuesday, let us celebrate and support initiatives that uplift families and strengthen our communities and the givers of life. I'd like to introduce at this time Christina Urbain.
Yes, thank you. I'm a short one too. So thank you to all of you who are here. Thank you, President Preckwinkle, Commissioner Miller, Dr. Makaitis, and our other guests that are supporting our continued commitment to provide quality care delivery services here at Cook County Health. I am Christina Urbina. I am the Director over Women and Children's Services here. And I stand proud and excited with my colleagues from both sides of me and in front of me to provide this announcement and the service delivery. So Cook County Health remains actively committed to birth equity and continuous demonstration of improved maternal health outcomes. We are a multidisciplinary integrated healthcare system and a multi-specialty healthcare system. We continue to ensure that our pregnant patients are at the center of their care, to ensure they receive the highest quality of care before, during, and after pregnancy. And in doing so, we have formally adopted the Cocoon Pregnancy Model, which is an evidence-based model out of Kaiser Permanente. And this model supports our existing framework that we've had here in Cook County Health of placing the pregnant patient at the center of a supportive layer within the care team. So this approach services to optimize their health, enhance their experience, all to achieve best possible outcomes. Doula services are a component of the pregnancy care model, for which we are very excited to now bring to Cook County Health. Having this workforce within our healthcare system will allow us to offer doulas to any of our pregnant patients receiving prenatal care within our system. And also it is their choice, right? We all are also offering choice if they want to choose to have this partner in their prenatal care. We currently have about 1,000 pregnant patients receiving care in our system. In Cook County Health, we offer prenatal care at all of our 12 primary care health centers located throughout Chicagoland, including our high-risk prenatal care clinic here on Stroger campus. So a doula empowers the birthing persons and or couple throughout their pregnancy, labor, and afterwards with postpartum and newborn care. They assist with informed decision-making and coping techniques that support the birthing parents. As we introduce doula services here at Cook County Health, we will employ 3 strategies that include administrative, clinical, and educational components. So I will next hand it over to my colleague, Shalonda Carter, who is a doula and a reproductive life planning coach here within our system, including Vivian Moreno, who is the program manager of maternal child health programs and a doula as well. But before doing so, I would be remiss if I didn't acknowledge my partners that work alongside of us to ensure that we are providing equitable access to quality care and wraparound services for all of our birthing patients. First, I'd like to acknowledge Dr. Fidel Abrego, who is the Chair of Obstetrics and Gynecology, Dr. Ashlesha Patel, who is the Associate Chair of Obstetrics and Gynecology, Kathleen Minogue, who is our Nursing Director of Maternal Child Care Services, Dr. Jacqueline Witten-Bailey, Chief of Nursing, and Kelly Matoyer, who is their Manager of Family Planning. They have all been key members supporting us getting this program together and integrated into our system, and will continue after today. So once again, we are excited to get started and respectfully thank every one of you here for partnering with us to get this going. I now introduce Shalonda Carter.
Good afternoon, everyone. Good afternoon. My name is Shalonda Carter. I have a background as a community-based doula, and presently I work at Cook County as a reproductive life planning coach, assisting with family planning and contraceptive counseling. I'm honored to be here today to share my experience as a doula. When doulas serve a family, we embody the attributes of being diverse, optimistic, unwavering, loyal, and an advocate, truly a calling to serve. As doulas, we are non-clinical labor support professionals trained to empower and equip women with the knowledge they need to make informative decisions about their care. Our role is to help women find their voices and use their voices. We do not speak for them. Instead, we support them in their self-advocacy. Doulas are instrumental in helping the partner to support their loved one during their most vulnerable moments in labor and delivery, especially in times when the woman is unable to make decisions for herself, such as in times of emergency. Being a doula goes far beyond simply being present at delivery. Our support extends throughout the entire prenatal and postnatal journey, This can involve attending prenatal appointments, high-risk appointments, helping the woman navigate barriers to prenatal care, and offering guidance during times of grief. We are there to provide physical, emotional, and mental support 24 hours a day. We serve as anti-stressors, companions, mothers, sisters, therapists, counselors, always present and always willing to serve. Thank you again, President Preckwinkle, Commissioner Miller, Dr. Makaitis, and everybody that is participating in this collaborative. Oh, I want to bring up Vivian Marino.
Good afternoon.
Good afternoon.
Thank you, Commissioner Miller and Madam President Preckwinkle, for your support on maternal child health programming here at Cook County Health. It has been an honor to serve couples, single parents, and fathers as a doula on a personal level. As a doula, it's an exciting time to be bringing this intervention, doula care, to Cook County Health, fostering a departmental culture that values reduced interventions for birthing people. The care teams involved are excited to have collaborative partners in labor and delivery while making a commitment to patient-centered care. I am uniquely positioned with the experience of a doula to be overseeing the doula initiative for this system. Currently, I serve as the maternal child health program manager. As Christina mentioned, Cook County Health is enhancing our current model of prenatal care by integrating doula care that respectfully and culturally informs birthing people while preserving their dignity and privacy through our current patient-centered care culture, which is an administrative strategy. A clinical strategy at Cook County Health will involve growing our practice of care model to alleviate stress during prenatal care, labor, and recovery for our patient population. Adding the doula workforce to Cook County Health will amplify the quality of maternal health care that we currently provide our families. The value our doulas will bring is increased shared decision-making with inclusion of positive rapport and open communication between the patient and their prenatal care medical team, while in labor, in the postpartum phase, and while supporting their newborn's care. Lastly, the educational strategy will include a deeper dive into the components and approaches for successful team-based care that incorporate doulas as part of the patient's medical care team. Once again, we are excited to add this workforce, and the lessons we learned through understanding the doula role in advocating to reduce disparities in maternal care for Black and brown persons. As Shalonda said, we serve as anti-stressors and companions, always present and always ready to serve. Doula care is truly a calling to serve and truly a part of the Cook County Health mission. Thank you for the opportunity to share our work, and we look forward to supporting positive family experiences at Cook County Health.
Well, thank you all for being here, and you can see that this is a great collaboration, many levels of government, hospital, community working together, and we are going to change the maternal health outcomes for women in Illinois. So with that, we will end, and I guess... Questions? Yes, questions? Okay.
Yep, thank you so much for that question. So this is new. It's a new program and a new workforce to Cook County Health. So we'll be implementing and growing and lessons learned as we go. So we have a partner that will be sourcing the doula workforce, and supporting with the training. So there will be training, external and internal, as we integrate them in our health system. Now, we do have about 1,000 individuals that are actively pregnant in our system, and this is a choice. We'll offer it to those who like it, who would want to partner with a doula, and not everybody will choose that. So we'll understand that more as we implement the program. So we'll be adding about 10 doulas. 10 doulas will be addition to the workforce. Thank you. Sure. Do you want me to hand it? I'll hand it over to Vivian since she's going to oversee the programming.
Thank you for the question. We rolled out a request for proposals, and through our procurement process, an organization by the name of Prism Healthcare has been selected to implement and run the doula program. I will be overseeing the management of that rollout here at Cook County Health System. 10 doulas will be hired, they will be onboarded, and they will serve patients that are partnered with them through our Cook County Health medical team's referral process. Those most at need who choose to have a doula, and then those doulas will partner with them by going to prenatal care visits as they choose, as they accept the care, and into labor and afterwards as the patient sees fit. There is a certification process, and there's a governmental agency that's overseeing that process right now. There's different types of certifications that are in place, but there's also different strategies for billing to be eventually entered into the system for private and public aid insurance programs.
Gradually, as we begin to roll the program out, we will follow a patient that has the doula services and see, the outcomes of her having that doula. And they'll be able to then tell how the doula services are at Cook County Health.
Your experience having worked with pregnant people, just what does it mean to have someone there? What type of interactions?
Honestly, it's different. I've serviced women from the ages of 16 all the way up to the ages of 23. Being a doula is not just the woman; it's all of the persons that are special to her that are involved. They love having a doula. I've cried with my patients. We've went over birth stories. We've sang songs during labor. We've danced during labor. It's just a pleasant experience overall, and I can definitely say those that I have serviced love having a doula. I can't get rid of them, and that's okay. I love that part of being a doula. It's a calling. We're here to support one another.
And I think one thing I'll say is that when we had our hearing, we had 2 public hearings, and we had doulas testify, and also patients who had used a doula testify. And really the feeling is that they are part of the whole birthing process, but also the important key, I think, is also postpartum. Because as we see from the data, there's so much that still happens postpartum that's also preventable, where the doula would be involved in that process as well. So we want to make sure that everyone understands the full spectrum of possibilities for the doula from the very beginning and even postpartum delivery for the patient. And you guys will make sure that that's explained to the patients here at Cook County Health.
And this would be a doula partnership with care at the hospital. We aren't talking about like home birth or are we?
No.
No, we're not talking about home birth. We're talking about a medical practitioner who provides a layer of support that's more on the emotional and physical aspects to the family that's birthing. As a doula, I've helped fathers who don't know what to do to support their partners when they're going to be in pain or when they're in labor. So part of that process is educating them, informing them, preparing them to communicate with each other about how they will be able to get through the pain and teach them coping strategies so that the partner that's there in the labor room can help their partner get through the birthing process as stress-free as possible. The doula is not intended to replace a medical provider. They're there to collaborate with the team that's already here. They will be using our electronic medical records to communicate with the medical team with our patient populations and their medical record. It's part of the team to have effective communication and collaborative process throughout the pregnancy care spectrum. Well, there's several things. You know, I can't speak from the medical perspective, but I can say that stressors affected my birthing process personally. I became stressed during the birthing process, and my dilation stopped, and I had to get a cesarean. So stress can really alter the outcome of the birth process. And if somebody is there to provide the level of support needed to help our patient population who maybe don't have a family member here in this country, or have a family member, but that family member has to take care of the baby that's at home because it's not their first pregnancy, we're there to provide them with a level of support that will get them through the process and reduce potential interventions that could be avoided. That's another great question. We will have a referral process here with our medical team. Everyone that is pregnant will qualify to receive a referral for a doula. You know, this is a rollout. It's a new program. We're anticipating that, you know, eventually we want to be able to serve every patient with a doula, because I know it's something I couldn't afford when I was pregnant earlier in my life, and we want to make access available.
Are you going to be limiting the number of patients who can have a doula in the beginning as you roll this out, or can you talk about that?
We're going to meet the demand as best as we can with the 10 doulas that we have at the beginning of this initiative, and we're looking and hoping that it's a success and we expand.
And can I just ask you, I just want to confirm, is CCH hiring the 10 doulas, or are they being provided through PRISM?
They are being provided through PRISM, who is going to be managed by Cook County Health.
And was this based on a program anywhere else, or Trisha, did you see this working other places, or where did this come from?
There were others, so in the state of New York, they actually got $2 million for the entire state of New York for doula services. So we took pieces of that as far as implementing it on our level to get funding here at Cook County Health. So as many people may or may not remember, we are the second largest county in the country here in Cook County, and our health system is the top public health system in the country. So when you look at that, so what happens here will set the stage for what other counties can do, what other health systems can do that provide the type of care that we provide. So this will be unique. So I don't think any other health system has this as a whole healthcare system. There's pieces of it that have been implemented in like the state of New York. I think Detroit had something, LA County has something, but nothing as comprehensive that we can find exactly as this one.
And what was it that started you on this goal, this mission to provide?
Well, so my background comes from industry. Before I became a commissioner, I was on the pharmaceutical side of the business. So I've always been involved with healthcare and healthcare disparities. So seeing the high level of disproportionate healthcare disparities that we have for maternal health, it's in the news, it's on the paper, it's in the internet every single day in some level about how Black women are dying. And here in the state of Illinois, our outcomes were some of the highest in the entire country. So I thought, there has to be something we can do. We have all the tools here. We have all the great people who can make a change happen and make something positive happen. But everything comes down to budgeting and money. And so that's our job as the fiduciary stewards of the budget of Cook County, is to be managers of that money. So finding money in the budget to start this program was the first piece, and then getting buy-in from the rest of the hospital system to make the program happen was the second piece. And of course, as you can see from all the experts who are here today, that wasn't a hard lift at all. And we already had internal doulas that gave their expertise. We have a great OBGYN team here at the hospital that is far state of the art compared to every other hospital as well. But we need to make sure that patients know what type of opportunities they have to improve their own health care, and this program will do that for them.
So we don't have any doulas employed in the Cook County Health System currently. So this would be the workforce that we're introducing. There are 2 part-time doulas that are part of a study, a grant, but this is really going to be the primary workforce that we are integrating into our system, but leveraging both to make sure that we are supporting patient care needs and really looking and assessing interventions, outcomes to really continue to enhance the care delivery model. Yep, another great question. I'm going to defer to Vivian. I'm going to give her the floor. She's going to be leading the program.
Well, we have a few different metrics that we'll be working on measuring as we roll this out. Some of which include 75% of our enrolled clients being assisted with lactation if they choose to breastfeed. 75% of those that deliver with a doula, that those get followed by the doula with the newborn visits and for a few months after they deliver. Those are important areas that we're trying to evaluate our success on. We want to make sure that those that agree to receive the doula intervention are able to make informed choice. So we'll also be asking questions and input and gathering feedback so that we continue to grow and learn lessons. It is a new initiative, and we want to make sure we're doing this correctly. So the patient feedback will obviously be very instrumental in making this a successful program. There's other measurables, but I don't want to talk too long. Oh, gosh. I would... Up to a year at least, and they are part of our medical, they are our patients. So at every medical visit, we'll be talking with them. The doula will be there. We also have other maternal health programming, so other programs that offer education and information and home visits, and the doula will be part of that. They're going to be the instrumental piece. Yes. Not necessarily up to a year, the home visit aspect, but they will be touching base with their patient for up to a year.
Okay. So, yes. And we just want to make sure we thank you all for your questions. And this is really just a great day to celebrate true collaboration, as well as the fact that we are going to be making an impact, because more women die here in this country than in third world countries. So we have to change that narrative. We have the best state-of-the-art healthcare systems here, not only just in Cook County, but in Illinois and in this country. And so we want to utilize all the tools in the toolbox to make a difference. Yes. Yeah, you guys have.
So it's very similar to our basic patient population. So we have, we are requesting some bilingual doulas. And bilingual meaning we want to address the languages that our patient demographic speaks. So there's going to be Spanish, Mandarin, hopefully. If we don't have doulas that speak those languages, just like we do every other patient, we leverage interpreter services to support.